I'm Brent Stafford, and welcome to another edition of RegWatch on GFN.TV. We're here in Warsaw, Poland for the Global Forum on Nicotine, GFN 22. In a minute, we'll be speaking a fascinating conversation, actually, with Dr. Marewa GLOVER. Now, New Zealand is a country that's had an up and down relationship when it comes to nicotine vapes. For a while, it looked not so good. But about a year ago, they passed legislation, new regulations that made nicotine vapes legal. And things look pretty good. Or does it? We had you back on the show about a year or so ago, and it wasn't for a great story. I think we titled that Shunned. Let's jump right into it. You know, what's been going on with your battle in New Zealand?
In New Zealand, well, I just continue on with my work and my studies. And of course, with lockdown, couldn't go anywhere anymore. So any studies involving face-to-face had to be shelved and put on hold. And so most of it has been desk work. But there's been some big changes. We had the vaping regulation go through, so that was a huge relief. The government has been running a Vape to Quit campaign, so encouraging people who smoke to switch to vaping.
So it was a real 180, wasn't it?
It was. Well, they had the campaign made some time before, but really needed the regulation to go through before they could launch it. So once that went through, they launched the campaign, and we have, you know, the smoking rates are going down, and then you see on the graph, as the smoking rates come down, the vaping rates are going up almost, you know. Yeah, it's a perfect kind of picture showing that vaping is displacing smoking. Which is excellent news.
So what happened to you professionally?
Oh, I just keep doing my work and pumping papers out. It's been difficult to get published, but I know that that's across a lot of sectors. Once, you know, with the pandemic, researchers just all turn to writing about the pandemic, writing about COVID, and a lot of research money and focus and effort just all switched away from whatever people were working on. And there's been concerns about that in the scientific community. So we ran a survey in the US, India, New Zealand, and Russia, online survey of people who smoke, vape, drink alcohol, and or use other drugs. And we got that up and running fairly quickly in the first wave to try and gauge the effects of lockdown. How were people coping in lockdown? It was my theory was that, you know, with the stress of everything, that people would actually smoke more.
And that didn't happen.
The research around the world tends to say some people smoke more, some people smoke less, some people stayed the same. So it's kind of mixed. For example, in New Zealand, many people didn't mind lockdown at all. It was like didn't have to go to work, or they worked from home. It was summer, it was warm, people, you know, got time off with family. So there were a lot of positives that it wasn't stressful. It was the opposite. It was like almost a holiday for a lot of people.
Is this your first GFN in person?
Since 2015, I've been coming to GFN.
So why?
Oh, it was, I was tweeting, and I was tweeting a lot about harm reduction, snus, because I'd already been lobbying for snus to be legalised in New Zealand. The organisation I was chairing, End Smoking NZ, had been lobbying for snus for about 10 years. And then along came vaping, and we looked at vaping. We were one of the first organisations to maybe this. And so we started looking into vaping. And I was tweeting about harm reduction and snus and vaping. And I got invited to come and speak at the GFN 2015. And I've been coming every year since. It was really a big turnaround, a big learning curve for me. I went back from that, went to visit the people at the Ministry of Health. I was like, we've got to do this. We've got to do this. We've got to, you know, encourage people to switch to vaping, because we didn't have snus. Ministry of Health was saying that snus was illegal.
So what is it then about the conference, the speakers, the mingling? What is it that is important about GFN?
It was the like-minded, other people learning so much from the consumers. That's a really huge difference between this conference and any of the other tobacco control or public health conferences that I'd been going to for, a couple of decades or more. Huge presence of consumers. They're part of the panels. There are sessions on the consumer's perspective, and they're the ones I really learned a lot from. And with my expertise in smoking cessation, I've been doing that for nearly 30 years now, and I can see how this is working and why it's working so quickly for people, why it's so easy for people to switch from smoking completely even, and transition. There's a whole transition pathway. So that harm reduction, and not just harm reduction, but the more in-depth understanding of harm reduction, I got that here, because there's a lot of people who come from drug harm reduction that are part of running the conference, and they always have that perspective there as well. And we never really had that in tobacco control.
It's interesting because I guess in harm reduction you have users, in vaping you have consumers.
Yes.
But it's both it's the end person. It's strange because even for us in our coverage, it's hard to just go out and get interviews with the consumer. It's their hard animal to find.
Really?
Yeah, because I think you'd have to hang out at a vape store, and most of them that come in are not really amenable to having a camera stuck in their face.
Okay.
And in Canada, we used to have vaping expos, which went away when vaping became legalized. That was one of the deals the industry made with Health Canada. So there were no, they didn't have any consumer expos anymore. And even then, the people that were coming didn't really recognize themselves as a vaping consumer. And so, if they weren't advocates, they were just somebody who vaped. Right? It was not very easy to be able to ask them too many of the questions like we talk about.
We also have lost vape expos in New Zealand with the vaping regulation. So the vape meets that were smaller local meetings and small regional kind of vape expos or vape meets, I began going to those. I don't know, that might have been around 2015 as well, or the first one was after that. The vaping regulation banned all of those. So that's a real loss.
Why is it that the regulators, at least in Canada and New Zealand, got rid of the expos? And why is it that the industry rolled over on that? Because it seems to me that those are extremely important events because they not only drive business, but they drive lifestyle.
They saw it as a marketing and promotion opportunity, and even though our Vape Expo was R18, they made a lot of, kids will get in, or so they really clamped down in our regulation on promotion of vaping and have restricted it to specialist vape stores. And it also dampened the online forums that people who vape had set up to help others. So they would educate other people, anyone in New Zealand that wanted to try vaping, and they would go onto one of the vape forums. I've been smoking this, or I'm thinking about vaping, or I'm trying vaping and I'm coughing a lot. And all of the people who were part of those forums would help them. So you had access to 24/7 support and advice from other people who had already vaped and switched. So those were really excellent. The vaping regulation kind of left it very grey about whether or not those were allowed to continue. I think the vaping regulation, one, it's kind of legitimised vaping as an alternative to smoking. It's got the government stamp of approval now. In one of our studies called Voices of the 5%, we're interviewing people who smoke who never were going to quit, or they didn't believe they would be able to. And actually we are, because we're following them through, and many have tried vaping now, and many have transitioned, or some have transitioned to vaping altogether.
This is fascinating. So, I mean, there was a time when it looked like New Zealand wasn't, so much in favor of vaping, and then that was what I meant by the 180, is they kind of all of a sudden, they really got behind it. And now it's a couple of years now, isn't it, I guess, that when did the regulation pass?
I think that only passed last year.
So last year?
Yeah.
Okay. I bring this up only because in Canada, right, we passed legislation. It became law. And then it didn't last more than 6 months before it, suffered under the moral panic of teen vaping and then EVALI. And, we're looking at in Canada here now complete destruction of the industry by the very government that legalized it.
Yes, so when I went back from GFN 2015, I went to see the Ministry of Health. The head of the tobacco section was dead against it. Then he moved on to another role within the Ministry of Health, and the next person was open to it. So she was much more focused on this. This could actually bring down especially Māori smoking rates, which Māori women's smoking rates are still the highest in the country. And so things began, it really did come down to, well, that person was against it and this person was very open to it. This could be a solution to more rapidly reduce smoking rates, which it has done that.
Is it getting the recognition for doing that in the regular mainstream media?
Oh, totally. I mean, there are a lot of people in media who were smoking. So many people, if I was interviewed by reporters, they were either vaping or they'd given up smoking, gone on to vaping and now didn't vape either. So media have a lot of people who, don't you know about that? The high smoking rates among people who work in media?
Oh, well, yeah, that and drinking and a few other things, I'll tell you. Yeah. Well, that's amazing. I mean, it's like I can't believe that story. It's such a good news story. I can't even possibly imagine it, say for an American or a Canadian, because the media hates vaping.
Right. Well, no, a lot of people in the media in New Zealand have been smokers and have switched. So, no, they totally got it. And many people in public also got it. It was like, well, why would you ban it? But it's safer, isn't it? So it's going to reduce harm, isn't it? So it's really only the staunch prohibitionists and anti-tobacco, anti-nicotine tobacco control people who continue to put out misinformation about nicotine, continue to try and ramp up this panic about youth vaping, and they just keep pumping that out there. But they're a real minority. And some of them have switched, when they saw that the horses bolted, they're not going to get this ban, and now suddenly they're the experts in vaping, and then they're winning all the research funding to study vaping.
That must be maddening.
Yeah. It's you've got to watch them, because we know that really they hate it. And so then you've got to worry about, well, what sort of research are they doing, how it's biased, how are they going to be treating these people who smoke and or vape. So they are very persistent in using stigmatizing terms, calling people dual users, calling them users, and, which we don't like to do in harm reduction, stigmatize people and label them.
Would you say the last year has kind of changed your outlook a little bit? Do you feel redeemed in any way?
Oh, I guess so. I mean, the evidence is just getting stronger and stronger and stronger. You do take a bit of a leap when you decide early when there's a new innovation or technology, and you go, no, this is going to work. And of course, there's always a what if it doesn't. But when you have decades of experience, you understand about the chemistry, you understand about behaviour, and I looked into all of that. I was pretty sure, yes, this is going to work. And of course, I met many people who vape at GFN 2015, 16, 17, and they were talking about improvements in their health. So when you listen to the consumer, it becomes clear, we are actually seeing reversal of some disease, as Ricardo Pelosi's found in the COPD studies and the asthma studies. So I feel that the evidence was even indicating strong enough for me to say, no, this is the way to go.
Do you think this will stick in New Zealand, or are the forces allied against vaping still, a challenge?
I know that in other countries that are still fighting, like in Canada, the New Zealand regulation is being held up as a model. How fantastic that we got that through. Look at New Zealand, do what New Zealand has done. But people need to read the wording in the regulation. It is a prohibitionist piece of legislation. It says we want to encourage people who smoke, who are aged over 18, which is we have R18, for access to tobacco and vaping products. Encourage people over 18 who smoke to switch to vaping. Nobody who doesn't smoke should ever vape. Anybody who has stopped smoking and vaping should never go back to vaping. And it's in the legislation, it says we must prevent the normalisation of vaping. So the normalisation and denormalisation, this is a key strategy of tobacco control. Denormalisation of smoking is all of the shaming, it's all of the punishing policies, it's the taxing, it's the banning where you can smoke. And so that is written into our vaping regulation, that we must prevent the normalisation of vaping. So once everybody has switched from smoking, so we had about 550,000 people who smoke in a country of 5 million, and now we're down to 450,000 who smoke, and that's going to continue to decline. Well, once you get them down there, and then the legislation also says, and then encourage people to stop vaping. So it's a plan to get them from this level down to this level, and then down and then off all completely. And no one is ever allowed to go back. So all of the policies, the smoking cessation services, so they're quite willing to help you and support you to switch from smoking to vaping. And then they may even say, and just keep vaping just to make sure you don't relapse to smoking. And then we'll work on getting you off vaping.
So it's a process that won't end until you stop your nicotine use.
That's right. Yep, except that we have nicotine patches and gum, and it's okay to be on those for the rest of your life. But it's not going to be okay to be on vaping for the rest of your life. The legislation is written in that way. You switch from here to there, and then you try to get off vaping.
So there's nothing to prevent the government, if they decide 3 or 4 years down the road that there's not enough people have made that move, or maybe enough people have made the move, and now it's time to cut the floor out underneath the vapors.
Exactly. Yeah. So what it has done is lay the groundwork for the next legislative change, which has already been proposed and is supposed to be introduced later this year. So they can see that, yes, people are switching. Now we just need to push harder. We need to encourage people to switch from smoking to vaping and make smoking even less attractive. So now we're looking at new legislation coming in. They want to bring in the cap on nicotine in combustible tobacco. So you will not be able to buy tobacco that has more than 0.5 milligrams per gram. So that's the very low nicotine cigarettes. So basically an ineffective product. They looked at banning filters in cigarettes, but that didn't make it through to what's going to be put forward. The sinking lid on the age of purchase. So from, I think, 2017, every year the age of purchase will go up by 1 year until nobody will be able to legally buy combustible products Are they going to do that to vaping? Well, maybe not at first. Let's get everyone off smoking onto vaping. But that's the precedent is there for when they decide, okay, a very small number of people smoke. Now's the time to do exactly what we did there, to now crunch down on vaping and see that eliminated.
So it seems like to me that this whole endeavor for public health and tobacco control is an opportunity to exercise a muscle of social engineering.
Yes, and there's a lot of excitement among tobacco control researchers in New Zealand that we may be the first, not just to do very low nicotine cigarettes across the board, but to do the sinking lid on the age of purchase. And the other policy that they're putting in is to reduce the number of retailers that will be able to sell the combustible tobacco products. So we have about 8,000 convenience stores that sell tobacco now throughout New Zealand, a country the size of Japan with 5 million people spread across. They're going to reduce that from 8,000 to 500 throughout the whole country.
Wow.
Yeah. So, for example, people in a rural area who already might have to, when they go to the supermarket a couple of hours away, do their big shop, they have to buy in bulk already. Well, will there still be a shop there that will be selling tobacco? So these are novel policies, and many people don't actually know, because it hasn't been done anywhere else, what the ramifications will be or the consequences.
Boy, this interview sure changed for me. There was a moment there early on, I'm going, wow, things really have made a difference in New Zealand and this is amazing, but we're really not talking about that at all. This is a quick march to a boot, on nicotine users.
Complete elimination of nicotine use in any form, yes.